My name is Dr. Bill Carter, class of 1987 at USF College of Medicine. I'm very pleased to represent the Alumni Society as its chair at this moment. And today we are spotlighting one of our alumni, Dr. Corey Howard, who has got a lot of interesting things to share with us today. Corey, how are you?
I'm doing great.
Good.
Thank you so much.
Excellent. So tell us just a little bit what your training was. I understand you have been a USF Bull for most of your life.
That is correct, yes. I actually came down to USF and did my undergrad here, followed by medical school. Really one of two medical schools applied to, and I was so happy to get in here. After medical school, I did internal medicine residency after spending a year of internship up in New York City, and said, I need to go back to Tampa.
Weather was better down here.
Weather was better down here. A lot of things were better, believe me. And then after that, I wound up doing a GI fellowship. During that time, I was also chief resident of medicine, and I also was the president of the House Staff Association and did a lot of cool things for all the physicians and residents at that time. It was very, very fun.
Well, we're delighted to have you on our board, by the way. Corey has served on our board for the last 3 years and done a really stellar job. And he has a lot of fresh ideas that we're going to talk a little bit about here in just a minute. But could you tell us, you're in private practice right now, correct? So you're a busy man.
I'm a busy man. A lot of evolution has occurred. You know, I started off in solo GI practice, and then realized that after about 10 years, I really wanted to focus on internal medicine and prevention and really learn more and more about that. Now, at that time, honestly, I was very overweight, and I needed to have a change. And that change brought me to become an Ironman triathlon. And after that, what happened was I learned a ton about nutrition, really dove into different aspects of care, and that brought me into a whole nother area, which was functional medicine. And I went ahead and did a cooking program for about 350 hours on plant-based nutrition. And then I opened up my newest practice, which has a yoga studio and a kitchen. It's really more of a direct primary care type practice, but I also am a life coach. So I add many different aspects to it, working on basically real health and wellness for people who are interested in their health and reversal of disease.
Well, that's fascinating. That's a personal interest of mine too, as you know. And keeping people well is really the key to solving our healthcare problems.
Oh, I totally agree.
Obviously. But one thing I want to tell our audience that's really, really exciting is Corey has assumed a new role. He's the president of the Florida Medical Association. I'd like you to tell us just a little bit about that, why you did it, and what that means for the College of Medicine.
Thanks a lot. Yeah, I'm honored to be the president of the Florida Medical Association. In fact, I'm the 142nd president. The Florida Medical Association has been around since 1874. We represent currently 22,000 members, and we really represent all physicians in the state. And we have several focus areas. Advocacy is one of the biggest ones. After that, we're really looking at education, collaboration, and finding ways that we can all work together to make the practice of medicine the best it can be for our patients. Being president basically involves me going to every single county, every single person, really promoting who we are and what we do. Because at the end of the day, the reality is that being a physician is not what we do, it's really who we are. And that's the unifying part. And when we look at it from that perspective, we can really start to do much, much better for what could be true health in healthcare. And that's where the Florida Medical Association, I think, is going to shine, especially during this year. And that's my goal. Does
your functional medicine career play into this?
It does in a big way because, it basically allows you to think differently. When you're looking at different aspects of care, you can stay inside of the box, every double-blind placebo-controlled trial, or you can say, what's possible? What can we do different? And then we start to look at mechanisms of why people do what they do and why they don't do what they should do. And you add all of that together, so you're not just adding a new medication, which if you have to, you have to, but you can look at alternative therapies as well. And that may include, herbal therapies or other supplementation if there's a reason to do it, not just to do it to sell stuff. But you can really do a lot more for patients by looking at the entire body, mind, body, and spirit, and look at that. And that's what functional medicine adds to the practice of traditional practice.
What role do you see that playing?
Well, I think I'm the first graduate from USF to be president, other than Dr. Altenberger, who was from the very first class of USF. And he was a superstar, obviously. But the Florida Medical Association and USF is a natural together. There's a lot of growth in the area of healthcare in Tampa, but Florida Medical Association is also doing some incredible things in health. And just this year, we're launching a healthy living initiative where we created a mechanism for people to get information right at the point of care, opens up the door for a conversation, which allows all of us to start getting on the same playing field and really start to enhance what we need to do, which is learn how to prevent and reverse disease, not just plug the bullet hole, so to speak.
Well, that's really fascinating, and we're very lucky to have you on our board.
Thank you.
And we're fortunate that your involvement in the Florida Medical Association will probably be bringing quite a lot to our table.
Oh,
so,
thanks.
Corey, I want to thank you for being with us and sharing a little bit about yourself.
Thank you very much.